State Champs Live is presented by Lawrence Technological University, where Blue Devils dare. The Michigan High School Athletic Association, promoting the value and values of educational athletics. Hungry Howie's, famous for flavor. And the Detroit Medical Center. Do you have a sports injury or are just looking to take your game to the next level? Go where the pros go. Visit dmc.org/gamechangers. Hey everyone, and welcome to episode 5 of State Champs Live, presented by Lawrence Tech. Hey, did you know that U.S. News ranks Lawrence Tech as a best value school? What does that mean? Return on investment. You're going to graduate as one of the leaders of tomorrow with a great degree that employers value. Only schools ranked in or near the top half of their categories are included because U.S. News considers the most significant values to be among colleges that are above average academically. Begin your future at LTU.edu. We are live right now on Facebook, on YouTube, and Twitter every Monday through Friday at 2 p.m. This week in State Champs history goes back 15 years. After all, State Champs is the longest running high school sports show in state history, maybe the nation. But we also want to celebrate the innovations that can make you a better athlete. My name is Lauren Planta, and joining me today is Detroit Medical Center sports medicine physician, Dr. Sadiq Haque. Thank you so much for being here, sir.
Thank you for having me.
All right, great. So before we get into today's discussion, we're always looking for ways to engage with you more on Twitter. Our Hungry Howie's Twitter question of the day is on the State Champs Michigan Twitter page. Today's question: which canceled winter state finals were you most looking forward to? Swimming, gymnastics, hockey, or basketball? Go there and vote, and we'll read the results tomorrow. Now, today we are talking about PRP injections. Now, it might sound scary, but it's an amazing treatment for injuries and other things. So we start our conversation. Dr. Haque, what is PRP?
So PRP stands for Platelet-Rich Plasma. And what that is your plasma or your blood is composed of different layers or different particles: white blood cells that fight infection, red blood cells that carry oxygen, and a healing layer of blood called platelets. And so what platelet-rich plasma is basically the platelets have something within them called growth factors, which are stimulate a healing process. As an example, when you get a cut on your arm or something, the platelets will clot up the cut and eventually stimulate the healing process so that the cut goes away. And so what we do in platelet-rich plasma is then take the blood through a routine blood draw and then spin it, and the blood separates based on weight, and essentially then we concentrate the platelets and inject that into affected areas. So what you're actually doing is concentrating the growth factors, and as you can see on that picture, we're separating it, drawing out the platelets, and then injecting that into affected areas. So we use this for a variety of conditions, including tendon issues, joint issues such as knee arthritis, and other applications that are not orthopedic include hair loss and scar revision and things of that nature.
So what specifically does it do?
So with the concentration of the growth factors, you're basically stimulating the body to create a healing process for affected areas. So for example, let's use someone like a basketball player who gets patella tendonitis. We're basically taking that blood, concentrating those growth factors within the platelets and injecting the platelets into the affected area of the tendon. And so that stimulates a healing process, thereby hopefully regenerating the tendon and reducing the pain and allowing the athlete to return to their level of pain and function, return to the level of play and reduce their pain and function, pain and improve their function.
How long has this been going on? When was this discovered and obviously realized that this could be a valuable tool in treating injuries and recovery?
Well, it actually was started in the dental literature and then subsequently got real popular probably around the mid 2000s, particularly in 2006. Heinz Ward of the Pittsburgh Steelers at the time sustained a medial collateral ligament sprain, or one of the ligaments that holds your knee up, and this occurred in the conference championship, so they had 2 weeks until the Super Bowl. So they utilized this to accelerate his healing process, and he was able to play in the Super Bowl. There's conflicting research as to whether that's the case or not, but in those kinds of settings, professional settings, they're obviously using anything they can to gain a competitive edge. For our typical high school athletes, we're trying to use this when other modalities haven't worked. So, for example, physical therapy, possibly steroid injections. So, platelet-rich plasma can then be used as a form of treatment to stimulate healing processes in chronic tendon issues or possible ligament tears. So, I've used this for high school athletes for patella tendonitis, hamstring tendonitis, Achilles tendonitis, and then recently did a baseball pitcher for partial ulnar collateral ligament tear, and that helped him avoid surgery. So he was able to able to play in his sport sooner than if he had a full-on surgery for the elbow ligament reconstruction of that ligament.
Well, that's obviously, the big goal. We want to be able to play as long as we can. High school is just such a short period of time. And for so many of us, high school is really the top level that we will play at. So for a typical high school athlete, how long does it take for the injections to work before they're feeling better and before they're cleared to play? Is there a kind of an average time?
Yeah, typically we're able to get our athletes back within a 4 to 6 week time frame. Of course, that depends on the type of injury that's occurred, or possibly the tendon issue that they're dealing with, and timing wise. So, sometimes I'll get a football player in the middle of a season who's sprained something and or has been dealing with a chronic tendon issue, and in that situation, if it's safe for the athlete to return in a different way, we'd like to try that before we would do a procedure, because once you do that procedure, it basically would take them out the rest of the season. So sometimes we'll wait until after the season, but as using that example, the baseball pitcher, we were able to do that during the off season. He played instead of pitching, he did played one of the positions, and then we were able to do that during the off season. He had plenty of time to recover. So the typical protocol would be a patient would come in, we would do a routine history of what the injury is like or what condition they're dealing with, a physical examination, any imaging such as an MRI or possibly an ultrasound, and then a determination would be made that after that if they have failed physical therapy or other types of treatments like anti-inflammatories or possibly steroid injections, and then we would proceed with a platelet-rich plasma injection, and with the knowledge that recovery could take 6 weeks or so.
All right, so I'm monitoring the Facebook chat, and we might have some comments and questions for you in just a minute. Two more quick questions. Where are the injections done? Is it done right at a physician's office? And really just kind of clear the air. Is it safe?
Yeah, so I'll deal with the second question first. That it is definitely safe. It is using your own blood, and so we're just again taking that blood, concentrating it, and putting it into various body parts for whatever condition the athlete or patient needs. So, for not high school athletes, but I see folks in their 50s and 60s, and we use this for knee arthritis, and it's been shown to be an effective treatment for that as compared to steroid shots or gel shots. And certainly we've used that for our other patients who have inflammation after, like, say, an ACL surgery or something like that. As far as how it's done, once that determination is made to proceed with the platelet-rich plasma injection, we schedule that visit. The patient's blood is drawn that day, and then spun in a centrifuge, which helps to concentrate the platelets. And then we, in the same day, inject that back into the patient, into the affected area, whether that's, say, the patella tendon or something else. And then typically, for example, if it's a patella tendon, we'll have them use brace and maybe crutches to reduce some of the strain and pressure on the joint, and then a gradual rehabilitation process with the help of a physical therapist, and hopefully getting the athlete back to their sport or activity in 6 weeks or so.
Okay, great. Your comments or questions for Dr. Haque in just a few moments. But first, it is time for This Week in State Champs History. "15 years ago this week, we featured the annual border battle in girls soccer between Northville and Novi. The Northville Mustangs came into the year the defending Division I state champs. This game, a seesaw affair that finished in a 4-4 tie. But later in the season, Novi went on to beat Brighton in the Division I championship to claim its first soccer state title in school history. This Week in State Champs History is presented by Lawrence Tech Athletics. For more information, visit ltuathletics.com. Novi girls soccer has won 5 more state titles since 2005, and last year were recognized as the #1 team in America. Let's get to the live questions and comments for Dr. Haque, and there are a few here. And one is, how frequently do you need to get these injections?
Well, the hope would be that if you have a particular type of condition, say patella tendonitis or the partial collateral ligament tear, something like that, a one-time treatment, particularly in our high school athletes, would be sufficient enough to resolve their issue. And I haven't found the need to repeat the procedure.
Okay, great. And another, are these the same as cortisone injections or stem cell injections?
So those are all different things. Cortisone or steroid injections are potent anti-inflammatories that can be very helpful in reducing acute inflammation. We generally don't use that in our younger population. It's really meant for our older population that has degenerative joints or arthritis. There's some increasing research showing that steroid shots with repetitive use can cause slow deterioration of knee joints or even tendons. So it's not really something that we want to utilize a whole lot in our younger population. Plasma injections involve a part of the blood, and then it's concentrated like we spoke about earlier. Stem cells is basically using a sort of a earlier process of the cell, and so you can harvest that through the bone marrow, and then through a needle aspiration or withdrawal of that bone marrow, then you inject that back into affected body parts. The important thing, and I do need to mention this, is these procedures, stem cells and platelet-rich plasma injections, are generally not covered by medical insurance. Platelet-rich plasma injections usually can run in the $500 to $700 range. Stem cells are quite a bit more expensive, and generally we don't reach for those in our younger population. So that's really for patients who have chronic tendon tears or bad knee arthritis that haven't had success with some of the other forms of treatment.
Okay, fantastic. I want to thank the Detroit Medical Center's sports medicine physician, Dr. Sadiq Haque, for coming on the show today. If you want to make an appointment to see if PRP injections are right for you or any of the myriad of treatments and programs they have to make you improve performance, go to dmc.org/gamechangers or call 313-910-9328. Thank you very much for your time today, sir. Appreciate it.
Thank you for having me.
All right, it's time now for the MHSAA Clip of the Day. that's your MHSAA clip of the day. All right, thank you, Holly Lacrosse. If you have a video of your teammates doing some sort of sporting activity at home, you too can have your clip be the clip of the day. Connect with us, and we'll check it out. Hey, RoboZone is your home for high school robotics. Our executive producer, Denver Rashawn, gathered up tons of footage from the first 2 weeks of First in Michigan competitions. He's also interviewing teams during the shutdown. Download our free State Champs app or search RoboZone Show on social media. Just look for RoboZone. We are also streaming our State Champs Esports League of Legends matches and other games at our State Champs Esports Twitch channel. So check it out. Tomorrow, we will have the new head football coach at Lawrence Tech, Avant Mitchell. How is the shutdown affecting recruiting? Is the NAIA taking a different tack to the fall season that is different from the NCAA? It's going to be a great conversation as we talk football on tomorrow's show. Please join us at 2 p.m. And if you know of a guest or a topic we should talk about here on live, please email our show coordinator, Amanda. Her email address is easy, amanda@yellowflagproductions.com. Stay healthy, and we'll see you next time on State Champs Live. State Champs Live is presented by Lawrence Technological University, where Blue Devils dare. The Michigan High School Athletic Association, promoting the value and values of educational athletics. Hungry Howie's, famous for flavor. And the Detroit Medical Center. Do you have a sports injury or are just looking to take your game to the next level? Go where the pros go. Visit dmc.org/gamechangers.